Well, thank you, Mahmood Khan, my good friend, for introducing me. But first, let me say what a great pleasure it is to be in Saudi, launching this very important report from National Academies. I do want to begin by thanking a few individuals and organizations, certainly to begin with His Excellency Bandar Al-Kunawi that we just heard earlier. And of course, my good friend Mahmood Khan, who is the CEO of Hevolution, and Her Royal Highness Hayat Al Saud, who is in fact the VP of Strategy and Development of Hevolution. Importantly, we also have the Gulf Health Council General Manager Salamin Alad Da Akil, who's here, but most importantly, of course, His Royal Highness Abdullah, who will be here later on. So for those who are not familiar with the National Academy of Medicine, I thought I'd first introduce ourselves to all of you to tell you who we are and what we do. Then, of course, I want to get into this big, really important topic of healthy aging, healthy longevity. So we are the National Academy of Medicine, which we believe is one of the most eminent academies of health and medicine in the world. We are part of the 3 national academies in the United States: National Academy of Sciences, National Academy of Engineering, National Academy of Medicine, under one roof. And of course, we were founded in 1863 by President Abraham Lincoln and Congress and chartered to be an independent, non-government academy that can advise the nation, of course, and also the world. Our work is not only in the United States, but globally, as you heard, and of course, in many parts of the world, we are very active in many of the issues in health and medicine. I think if we were to think about our academy, I think about 2 things. One, of course, we have amazing members. As you see there, we elect only a few, but we have over 80 Nobel Prize winners in our membership. But more importantly, we have the experts from all different fields, bringing together members and non-members to do what we do, as you see in the second part of the slide on the right-hand side: advise, convene groups, produce reports, catalyze and set agenda, and influence policy, United States and globally. Next slide. Here's some examples of things that we have done. First, in 1999, we released a report to Errors Human, which was the first report to say medical errors are being made in hospitals and medical practices, and over 98,000 people are dying in the United States each year from medical errors. And that, of course, launched the whole movement of patient safety and quality globally. In fact, it was 4 years ago, in March 2019, when I was here in Riyadh at the World Summit in Global Patient Safety and Quality, along with, of course, with Minister of Health, Tedros, the Director General of WHO, Don Warwick, and others. So I'm so glad to be back. We've also done very important areas, for example, in HIV, because in this report in 1986, we said HIV is a global crisis epidemic. At the time, it was thought to affect a very small number of individuals, because that launched the whole issue, including PEPFAR, that is now the major source of support, of course, and globally for HIV patients. In 1988, our report says we should sequence the human genome and map it. Even at that time, geneticists and experts says it's not possible, it's too difficult, too much information, because now we know we can sequence human genome for $500 or less, and I know in Saudi and Qatar and other areas, there are major initiatives going on human genome and precision medicine. If you look at one in the middle, human genome editing, we wrote this report, 2 reports, to say what are the ethical issues, cultural issues related to human genome editing. And importantly, going towards the end, if you look at 2021, with the Secretariat for the G20, financing pandemic preparedness and the response, which is now, of course, resulting in the creation of the Pandemic Fund in WHO. So we're very proud of what we've done. But we're here today to discuss this really important issue: global aging, major demographic change. If you look at the lower right corner slide, I think that data is quite alarming. If you look at the trend, look at green line, you can see the line of people over 65 are increasing rapidly. And the blue line shows you that the number of people under age 5 is decreasing rapidly. In fact, in 2020, the two lines cross. So today, we have more people older than younger. And that's really alarming because over time, you can see that by 2050, 20% of the global population will be over 65. And if there will be 1.6 billion, and of course, the number will get much higher. Now, one of the reasons for this curve is that, of course, people are living longer. People are living longer lives, better economy, better hygiene. But also at the same time, fertility is dropping. If you look at the left corner of this, actually right, sorry, the right side of the slide, you can see that actually in the top, all these countries are dropping fertility rate, but on the top is actually North Africa and the Gulf region. You can see the significant reduction in fertility. So as a result, what we call demographic population pyramid, which is shown in the upper right side, you can see the traditional pyramid is young people, very few older people. By 2020, this pyramid is changing. It's not a pyramid anymore. And of course, by 2050, one expects to be almost a cylinder. So the shifts of population, for example, in places like China and Japan and elsewhere, we may even see an inversion of this pyramid. Now, what does that all mean? Well, first, in the Gulf region, you can see that since 2010, there's an exponential increase in terms of older population. It's predicted that the population over 65 in the Arab region will more than triple by 2050, reaching 102 million, or 11% population. This is a very alarming number that we need to be aware of. And of course, you think about the implications of the age. We all know that there's age-related diseases, that patients who are people that are older than 65 have 3 times more chronic diseases, NCDs, such as hypertension, hypercholesterolemia, arthritis, cancer, you name it, shown in this slide. And if you look at the trend, you can see that from the younger population to older population, the number of chronic disease increased significantly. Now, what does it mean to this region? Well, we look at the MENA region, Middle East and North Africa, we know that you are at high risk for NCDs, and particularly for those over 65. Obesity is a major problem. Cardiovascular disease, cancer, diabetes, and others. And in Saudi Arabia, it's one of the highest rates of NCDs, particularly in terms of obesity and diabetes. And you can see the numbers here. What does that all mean? This is occurring in the younger population now in your region. So when you imagine people reaching 65 and older, this will be quite severe and quite prevalent. So I think the time for now is to intervene early in a life course approach, not just elderly, but throughout the life to reduce NCDs, to reduce diseases when people reach older age. Now, what are the consequences of this demographic change? First, of course, as I mentioned, chronic conditions, increased prevalence, and patterns. Second, of course, as you can see in the top line, healthcare demand will be increased. And of course, healthcare financing becomes a continued problem for everywhere in the world. Third, of course, is changes in family structure and relationship. With the economic development and change in fertility, as I discussed, and change in marriage pattern and increase in older population, this will create a significant problem even in this area in Saudi. Why? Because families they're more older people, but the families are getting smaller. Also, many of the individuals are now employed outside families, so there are fewer caregivers. So more older people, fewer caregivers, this could be a significant problem. And of course, those who are older, who live alone, are more vulnerable to isolation. And of course, as we say down there, social structure will change. And of course, there's going to be more demand on pension benefits and much fewer people working, especially when you don't have the younger person and the old person retiring. So this is a significant challenge that everybody's faced with going forward. So the question we need to ask is, is the world prepared? In these studies I've looked at, in CSIS, Global Aging Preparedness Index, and the Help Age International Global Age Watch Index, the conclusion is very few countries are prepared. And if some countries can do well in one area, but not in other. So as you can see in this slide, on the right-hand side, I said we must prepare financially, socially, and scientifically for longer lifespan. It's a global imperative. This is why we became engaged in National Academy. We launched the first grand challenge, which is meant to be a bold public-private partnership to address a big issue. And we chose health and longevity as our grand challenge. We launched it, as Dr. Khan said, back in 2019, 4 years ago. And of course, we had two components to this grand challenge. One is the called Global Roadmap, which we're here to discuss today. And second is a global competition. In the global competition, as I discussed tomorrow at a meeting in the university, that we have launched competition for people to do more research, more ideas, to bring more new ideas to this area globally. We have involved 50+ countries, 12 sponsors, and I'm hoping the Gulf region will be one of the future sponsors. In the roadmap, which you're here today, I think what we did is we did a comprehensive assessment of the challenges and opportunities presented by global aging and look at solutions and, of course, directions for improving health, productivity, quality of life. Policy changes, decision-making changes. Next slide. Oops, sorry. So this, in fact, is a global roadmap that Dr. Khan talked about. And, of course, we asked the question, what are the changes necessary? What are the policy areas, investment areas that are necessary to go forward? As Dr. Khan said, we put together an international commission made of people from all different continents, different countries. He already mentioned that to you. I want to acknowledge the two co-chairs, Dr. Linda Fried, who will follow me shortly afterwards from Colombia, and Dr. John Wong from National University of Singapore. You can see in this slide, up in the upper right corner is, of course, Dr. Khan, who's been a major contributor, if you will, to this particular commission. This commission is overseen by an International Oversight Board of distinguished leaders, which is co-chaired by me, by John Jenkins, who's the CEO of the largest nonprofit organization for retired people called AARP in the United States and globally, and of course, Keizo Takemi, who's a major counselor, the member of the parliament in Japan, and you can see we have many significant individuals on this board. So, we were able to release a report 6 months ago, a little bit over 6 months ago, called Global Roadmap for Health and Longevity. And we recommended promising solutions for policymakers, government and non-government organizations, private sector to improve health, productivity, and quality of life. So you're going to see from Dr. Fried and from the report the following slides, which I've mentioned briefly. First is the whole virtuous cycle of health longevity. As you may see in the lower right-hand corner, what we call enablers, it's really important to consider the environment which older people age. There is work, there's social environment, there's physical environment, and there's health systems. And all these four have to work in concert to enable a health longevity as seen in the upper circle. In health longevity, you can see that by being able to increase longevity, increase productivity, increase economy, increase health, which will lead to the lower right, left-hand corner circle, increase capital, which is human, financial, and social. And of course, in the middle is a commitment called social compact to make sure this is available to everyone, equity, and to make sure there's social cohesion. Now, on the upper right corner are the disruptors. These are the things that make health longevity difficult. And these are things that we must address to overcome them. And our report addressed how to overcome these disruptors and also to enable the right environment. So what are our recommendations? First, we must invest in public health to promote population health across the entire life course. Let me emphasize again, it's life course. In other words, as I mentioned earlier, NCDs start very early. But if you start preventing early, when you age, you'll be much healthier. So it's a public health issue. Second, shift the healthcare systems from sick care to healthcare to have better prioritized health longevity. Third is to promote cultural sensitive, patient-centered, and equitable long-term care, which are so important for the older population. Fourth is to recognize that the best circumstance for aging healthily is a good intergenerational community, living with younger people, interacting with a community of healthy living. And because you have to think about the financial challenges of people getting older. In our country, many older people don't have actually enough money, and some go into bankruptcy. Even pensions and others are not enough. So we have to create financial security. And of course, when it comes to workforce, we have to enable people who are able to work to continue to work. The whole issue of retirement should be discussed. That is to say, if I'm over 70 years old, I'm able to work, I want to continue to contribute. We need to enable older people to work along with younger people, because that will produce a very good workforce environment. And older people have so much more wisdom to help the younger people to work. So that's one way of addressing workforce. And finally, of course, we need to invest, activate science, technology, innovation. And tomorrow I'll talk a lot more about those opportunities in terms of what science, and you'll hear some of that this afternoon on investment in science and others. So what if we don't do anything about this? This is called the cost of inaction. Number one, more people are living with poor health, more older people, but more people living with poor health with suffering and dependence on the family and others. Number two, the GDP is lower because with better health and full inclusion of older people, GDP will be even better. It's a silver economy. Three, increased fiscal burden on the government, particularly in terms of health care and also in terms of pension. Fourth is increased financial burdens on the individual and family, as I said earlier. Certainly we see that in our country. Fifth is the loss of contributions to older people well-being society. And you'll hear from Dr. Fried the importance of older people being able to contribute to society in many different ways. And of course, lost opportunities for people of all ages. We don't have the intergeneration benefits of people working together. As Dr. Khan said, this is a very important issue. This is an important global issue. So we have taken this issue very seriously. We have launched this in Singapore, in Washington, and now, of course, in the Gulf region. We're so pleased to be here to tell you all about this. But also importantly, I would like to point out that we've also been in Japan and in London, releasing the report, and many other activities, because we want all of you to be aware of this and to work with us and to work with yourself and your own countries to start addressing the issue. There are many other things we're working on in terms of communication. Time would not allow me to do this, except I'm here to say, let's collaborate. We're very, very pleased to be here, very honored to be here. We want to work with you. And I do want to thank Hevolution, King Abdullah Medical Research Center, and of course the Gulf Health Council for co-organizing this important event. Thank you very much.